In this video, we'll be speaking majorly about cancer and tumor markers. So cancer has been a menace over the recent past, and it tops the list in one of the main killers in the world. So this is Judge's Solution, a channel that helps you maintain a healthier lifestyle and stay informed medically. Just be sure to hit the subscribe button to be updated whenever we update more of such content. So what is cancer? So cancer is the uncontrolled or abnormal growth of cells anywhere in the body. So most cancer cells are composed in tissues, and they are further identified by the tissues in which they occupy. For example, we can have breast cancer, we can have lung cancer, we can have colon cancer. The body is made up of living cells. So these cells are constantly always dividing in the earlier stages of life. So when they divide, they produce new cells. The growth of cancer cells is different from that of normal cells, because cancer cells always grow uncontrollably, and instead of dying, they can elongate their lifetime and even produce new cells that are also constantly growing and dividing uncontrollably. That this is uncontrolled growth is what makes a cell a cancer cell. So various cells become cancerous because of DNA damage. But most of these cells, they are killed. The system detects and it does away with them. So in cancer cells, when the DNA is damaged, the damage is not repaired. So this cell further goes on and replicates and produces more and more cells that the body does not need. So people can also inherit damaged DNA cells from their parents, but most cancer cells are produced by environmental interaction. When your body is exposed to some carcinogen, carcinogen is a cancer-causing agent. 90 to 95% of the cancers that exist are caused by environmental factors, and only about 5 to 10% of the cancers that are available are caused by genetic mutations. So some of the environmental factors that lead to cancers include things like tobacco smoking, dietary intake, radiation, both ionizing and non-ionizing radiations can lead to cancers, stress, and also lack of physical activities and pollutants. All these factors, all these environmental factors can make a person have cancer. These factors enhance abnormalities in the genetic material of the cells. So the cell's production is an extremely complex process that is normally tightly regulated by several classes of genes. Tumors are groups of abnormal cells that form lumps of growth. So there are different types of tumors depending on whether they are non-cancerous or cancerous. So we have the benign tumors. So benign tumors are non-cancerous, and they rarely cause serious problems and are non-life threatening. And we also have malignant tumors. So malignant tumors are cancerous tumors. So we have different types of cancers and their locations. Like we have the carcinoma. So the carcinoma is mainly and most frequently found in the skin, nose, mouth, throat, stomach, intestinal tract, glands, nerves, breast, and the urinary and the genitals. Sarcoma is found in the connective tissues of the body, like the bone and the cartilage and the tendons. And we have the melanoma. They arise from the melanin containing cells of the skin. And we have the neuroblastoma. They originate from the immature cells found in the central nervous system. And we have the adenocarcinoma. They divide and form cells in the endocrine glands. Then we have the hepatoma, originate from cells in the liver, of course. Then we have leukemia. Leukemia is found in the blood and blood forming tissues. Then we have the lymphoma that originate from the lymphatic system. Definitive diagnosis of cancer requires the microscopic examination of biopsies. Biopsy actually is a part. We suspect that maybe you have lung cancer or you have skin cancer. We take a part, we take a small portion of that skin or of that lung, and we take it into the laboratory for processing. So in the lab, we do what we call tissue processing. Most cancers can be treated, by the way, and the possible treatments include chemotherapy, radiotherapy, and surgery. The progress is influenced by the type of cancer and the extent of the disease. So there are some cancers that have highly metastasized. Metastasized means they have highly advanced, or they have highly spread to other organs. So in such a situation, the treatment of the cancer will be quite difficult because it has greatly spread to other organs. Tumor markers are substances that can be found in the body when cancer is present. A tumor marker will always be found in the body in higher amounts when a certain type of cancer is present in the body. So tumor markers are significant for screening and early detection of cancer. They can also be used in the diagnosis of cancer. They also help to determine the prognosis or the outlook of certain cancers. They also help us to determine the effective of cancer treatment, and they also detect the recurrent cancers. Some of the common tumor markers include things like AFP, the alpha fetoprotein. It can be used to guide and treat, for example, in the situation whereby you have liver cancer or hepatocellular carcinoma. We also have beta-2 microglobulin, which is B2M. The levels are high in multiple myeloma, chronic lymphotic leukemia, that is CLL. We also have the bladder tumor antigen, the BTA. So the BTA is found in urine of many patients with bladder cancer. We also have cancer antigen 15-3, CA15-3. CA15-3 is mainly used to watch patients with breast cancer. We also have cancer antigen 19-9. It is a glycoprotein that is produced by adenocarcinoma, for example, the pancreas, stomach, and the gallbladder. We have the CA27-29. It is another marker that can be used to follow patients with breast cancer during treatment. We have the CA125. It is the standard tumor marker used to follow women or after treatment for epithelial ovarian cancer. We also have the calcitonin. So the calcitonin, it is a hormone that is produced by cells called the follicular C cells in the thyroid gland. So we also have the carcinoembryogenic antigen, the CEA. We have the chromogen A. We have the human chorionic gonadotropic hormone, HCG. So the HCG, mostly they are produced in the ovaries and the testicle, but germ cell often appears on the body. So HCG is high in some testicular or ovarian cancers. We have the lactase dehydrogenase. We have the neurospecific enolase. We have the NMP22. We have the prostate specific antigen, the PSA. So the PSA is a tumor marker for prostate cancer. We also have the prostatic acid phosphate, the PAP. We have the S100, soluble mesothelin related peptidase, thyroglobulin, etc, etc, etc. All those are tumor markers that can help us diagnose various types of cancers. So that was a brief video over cancer, and your feedback is highly always valued. So if you enjoyed the video, be sure to hit the like button, share widely, and don't forget to subscribe. And if you have anything concerning the video you might want to know, just write down there in the comment section so that I can review them, and I'll be glad to answer whatever you ask in the comment section. That was George's Solution.